Uganda, like many other countries in Africa, is facing an increased burden of non-communicable diseases. As we are bringing malaria down, as we are bringing HIV down, we are seeing now non-communicable disease curve going high.
And the reason why we are all here today is to transform the reality in Africa.
We found that 24.3% of adult Ugandans have hypertension that needs treatment. Almost 80% of those with hypertension didn't know that they were sick. So I want community engagement, communities to know that you don't have to have symptoms to be sick. We must train health workers.
Looking at NCD care from the beginning of where it starts, awareness and education, all the way to ensuring that it's optimized for their own needs and optimized for the health system overall. We can do all this front work, but if we don't have access to quality, affordable medication, we would have failed.
For sustainability, things must be driven from the grassroots, and we are taking the grassroots approach, where we have to mobilize our communities to take health into their own hands and be responsible for their own health. Faith needs to move away from just goodwill, but do things the way they are supposed to be done.
You see, in many parts of Africa, being born is like playing the lottery. You could win and survive, or you could die. Africa's choice is between poverty and prosperity. It is the people of Africa who have no choice. It is the private sector who have no choice because, you know what? Investing in health is not a choice. It's an imperative for your business sustainability. And if you don't invest in universal health coverage, your businesses will not be sustainable.
Very stimulating ideas emerged out of the breakout sessions, and it was superb and encouraging to see deep expertise from across the various domains and great thinking.
If we are talking about universal health care, it's around service delivery, but what we really are focusing on is universal health coverage. So there are social determinants of health, and so there are other sectors involved in our conversations. Yes, we do need more money for health, but the truth is we can get more health for the money that we already have.
Technology will give us equity. That technology should be built on a centralized architecture that recognizes disparate yet important applications, that speaks to the African ground truth through interoperability. So we shouldn't look at it piecemeal. We should look at a complete end-to-end solution.
The best way to go is to do pooled procurement. When you're bigger, people listen to you. Do it together. Private, public, it doesn't matter.
You need to separate politics and policy. We need to improve public-private dialogue. We don't talk to each other. The synergy begins when you can openly discuss what your strengths and weaknesses are of both public and private.
Health is just too important to be left to politicians alone. We must have a whole of society approach from industry, civil society, financiers, and consumers.
What we've taken away is food for thought. How does the solution suggested here marry with the realities on the ground in our home countries?
Some of the different discussions that came out were really thought-provoking, and it was really nice to see engagement from the audience and really lively discussion amongst the panelists.
The key message is we have to keep moving and everyone has to be on board.